coronary heart disease, you don't lose all your quality of life. You lose a certain part of your quality of life. So you take that part, maybe you have only 50% of your health left. And then it counts half. And for some other diseases, you only subtract 20% of healthy life. It depends on the severity of disease. So it's a measure where you both have the length of your life, but also the periods with the severity of the disease. I think you've learned about this also in the epidemiology classes. And here you have a figure where we show the distribution of these DALYs by age and sex. You can see that here are all the different diseases. And you can, for example, see that after the age of 40, which is here in this period, that most DALYs in blue, in light, well, middle blue, are because of CVD. So it adds a lot to the burden of disease. This is worldwide. It's from the Global Burden of Disease study, but also in Western countries you can see this pattern. So a lot of DALYs are lost after the age of 40. Here you can see the small COVID-related DALYs in the bottom, for example. And also I show you here diabetes and kidney diseases, which are here somewhere. They also add a lot to the loss of DALYs. So that is why I want to have a course on cardiometabolic diseases, because we are working on something big. This is really a burden to people and a burden to society and to healthcare cost. So it's an important disease and it can be prevented to a large extent. So what about the course? Well, you will learn a lot in this course about of course, the cardiometabolic disorders themselves, but also the risk factors, the disease processes, but the clinical aspects will be in the course, and also about some research-related issues. Maybe you're thinking already of your thesis in your master phase. Well, we have a lot of research going on that might be of interest to you. So I hope that after this course you are able to explain biological processes that contribute to the cardiometabolic diseases, dietary factors, their role in the etiology and treatment of disease, the type of measurements and techniques that we use in research, some medical aspects, diagnostic criteria, medical treatment of these diseases, and also some metabolomics, genetics, epigenetics, microbiome related issues. So it's quite a large variety of topics, and I hope there's a bit in this course for everybody. Some of you are more like from a molecular background, others may be more interested in societal aspects, and others more into the medical aspects. So I'm really interested to see that all come together and to learn also from you. We will also work on some skills, and that will be done mainly through group work. So you should be able to form an opinion about a hot topic in the field. I will come back to that later. It will be on the GLP-1 receptor agonist. I don't know whether you heard about Ozempic, for example. So the place of that drug in the treatment, but also all kind of nutrition-related issues with these drugs. And you should be able to express your opinion. So we will have some group presentation, we will have a nice group report. Because when you sit at the birthday party with some people and they know you're doing this course, you should be able to at least explain to them why nutrition is important for the prevention of cardiovascular disease. They will ask you, and what's your answer? You cannot always say more research is needed. It's a big, a lot of things happening in that field, but I don't know. You should be able to defend your standpoint, to formulate, to form an opinion, and to express that as well. So in our course, we have me as the examiner. So I think you can also, when you have really some concerns with the exam, or whether you are able to do the exam, or you can always contact me also for the general outline of the course if you have some issues. But Nea will be your contact person for all daily business, so the course coordination, and she will also hand over a lot to Femke Fleur, who is the course assistant. And so together we, the three of us, Femke Fleur, me and Nea, we are a bit of the team that will guide you through the course. And then we have our teachers, and you can see them all here. It's really nice that it's such a mix of people. Some are medical doctors. Sander at the right hand corner, he is now working in Cornell University. He comes to the Netherlands every year, and he will teach you as well. So please be there, because he comes all the way from the USA, and then it's nice for him to have some audience. And that's also true for the others. So please be present in the classroom. So that we have also interaction, just face to face. It's much nicer than only online. So there is a course schedule. We might work on the course schedule during the course, so please check for updates. But it will be in the afternoons during this period. It won't be in the mornings. You can see that there's, when we look at the themes, the first week is about introducing you to this field. Then the next week will be on diabetes, and there's quite a bit of self-study, which has to do also with one of the teachers who left our department, but we think her recordings are really good, and you can do that by yourself. And then we have just a question hour, the discussion with me and maybe some others. Anything that's not clear then can be discussed during that time slot. So next week it's a bit more of self-study. Then we have a molecular week about precision nutrition and how to the microbiome, some other molecular aspects. This week is about cardiovascular disease pathophysiology. It's arranged by the Human Animal Physiology group, and they will have a practical online, so it's not practical on campus but online. But I don't know whether she will do that in class or not, but we will.
I can talk more about that.
You can talk more about that. This is about all kind of more hot topics in nutrition related to this field. More research will be discussed also during this week. And then the last week will be about clinical aspects. And then we will have a nice excursion to the nearby hospital Gelderse Vallei. Some patient demonstrations. It is on Sinterklaas.
No.
No? No?
The presentation is on Sinterklaas, but the excursion is 20.
Okay, that's good. So the excursion is here, but it belongs actually to this week. But we do have some group work, but we planned that early in the afternoon so that you can celebrate Sinterklaas in the evening. So it was the only way to organize the course. It's very complicated with different teachers to have the course schedule fixed at some moment. Yes.
Just remind the students of a couple of elements.
Yeah. Do you want to stand here and use my microphone so that others can hear as well?
Is this the last slide before a break?
No, not yet.
So when would be a good time for me to just go over? I think it'd be nice to have.
Yeah, you can do it now.
Yeah?
Yeah.
Is that fine?
Yeah.
Alright, so just to...
But you need the microphone. Yeah.
Okay.
Yeah. So.
I hope this is not interrupting the flow too much, but I just wanted to use this opportunity to just reiterate certain elements, practical elements, of the course. our lectures are going to be recorded, but there is no guarantee that every lecture will be recorded the way we had hoped it would be. There's sometimes technical glitches and things outside of our control. So please always use the recordings as a guide to your study of the final exam. But as much as you can possibly be physically present in class, that would be great, and I would strongly encourage you to do that. Just use the recordings to guide study, and on occasions where you really cannot make it for whatever reason, let me know. So that was one aspect. The other aspect was to make sure that your next week, to just remind you, and I'll remind you again as well, but just to remind you that for next week, when we're talking about the pathophysiology of type 2 diabetes, Mariana has said that this was going to be self-study, which is it will be, and it will be guided. So you will have some orientation in the form of a document to tell you what elements within the course and the course material are particularly important for you to understand, engage with, and study for the exam. Right? So you're not just going to be left by yourselves. We will guide you, and like Mariana mentioned, there will be a discussion session for you to come prepared with your questions. We will talk, we will learn from each other, and we'll be able to answer some of the questions that you have. Yeah? So that was the other element. The practical sessions this year, for the first time, are going to be online. We have blocked room space for you, but we request you to BYOD, bring your own devices and chargers. You are free to use that space, and that is potentially one session that you may also choose to follow remotely, as long as you're there. It is quite mandatory for you to do those practicals. We're going to be less, encouraging of you to physically be in that room, because it's an online practical. You could use that flexibility to log in online, be online, present online, but from a location of potentially you're choosing. You have a little bit more flexibility, but we have rooms reserved for that purpose. So that's something for you to know. The excursion is on the 28th, which is a Friday. This has always been such a highlight of our course, with all of the students going over to meet with the healthcare clinical team at the hospital. So I encourage all of you to be there in person. It's a very, very fun, interactive day, and it makes a lot of the learnings from this course very clear to you. You actually see them play out during the course of that day. So that'll really help. And finally, as Mariana mentioned, we will have a group presentation. Now this is, we couldn't organize it any better. We tried, but this is scheduled for the 5th of December. For now, it's scheduled between 2 and 3:30.
I thought 1:30.
Yeah, no, I wanted to check from the students if they were going to be okay to have it earlier. Because,
okay.
Yeah, I don't know if, So, in case it was conflicting with some of the other classes they had,
okay.
I will update that. In fact, on Brightspace, I think I already did. Sorry, Mariana, I should have told you about that as well. It's scheduled between 2 and 3:30. We have some possibility of moving it earlier, but we're cognizant that it might coincide with some of your other engagements for that day, course and education and study engagements. So we've for now blocked it for 2 to 3:30. And during one of the course, the group work days, I'll ask you if you think collectively we could, if you wish to have it moved earlier, we could do that. If not, for now it stays at between 2 and 3:30. Right? So any questions that you have with regards to your registration, access to documents, anything at all, please feel free to reach out to me. We will keep giving you access to different material before the day of the actual presentation. So your division into groups, for instance, we're working on now, and you'll know before Thursday and on Thursday.
Yeah. Can you also say something about Brightspace?
Yeah, sure. So Brightspace is where you will have all of your information about the course. I will make sure that you are any announcements, any updates. I will send out a message that should alert you in your emails to go to Brightspace and have a look. If it's at very short notice, I'll even send you emails personally, but otherwise all of our course updates will happen through, and course communication about the course in general will happen through Brightspace. Currently we have, and you should also have access to the study guide, the schedule, all of the material for the first 2 days of this week, so week 1. Some information about the hospital excursion and some information about the group activity. Yeah, so you can engage with that. And as we progress through the course, I'll keep releasing more information as it's relevant. Yes, that's, I think, pretty much.
This is the last one before the break.
Oh,
it's
yeah.
about the exam.
Yeah. Do you want to talk about that?
Yeah, I can tell that. Yeah.
All right, thanks very much.
So, participation in the group work is mandatory. So, and that makes 25% of your final mark, so final grade for the course. And it should be passed with at least 5.5 mark. The exam will be 75% of the final grade. And that also needs to be passed with mark of 5.5 or higher. You need to pass both to be able to complete the course. If you miss out on one of them, then the other mark will remain valid for 3 years. So, so the exam is open-ended questions in answers. So we prefer open-ended questions. And that I will give some examples of exam questions also during the course. So it will be A, B, C, D, E questions per week. So every week, week will have its question, and there will be 2 other questions that overlap for different weeks. So try to cover all that you have to study during the course. And it will be on the 16th of December. And I think it's important that you are more than your grades. I like this course also to get to know you. So we will probably meet later on during your master phase or during your thesis, or maybe in the field when you work in the field. It's not only about having high marks, it's also about just engaging with the course, and asking some questions and dare to make some mistake. This is a safe environment also for asking all kinds of questions, and just ask me also things like, how is it to work in this field? And I am in Helix tomorrow, can I just walk by to have some, just to have a chat or to have a coffee or something? We want to be open to you, to interact, and yeah, it's important that you feel also in this course that you are working as a scientist, you are preparing also for a future job, and see how we may even disagree on some issues. As scientists don't always agree, you can also debate some things with us, you can just say if you don't agree, so feel free to do so. So I think it's now time for a short break, so let's get back in 10 minutes. Okay, did you have your coffee? So let's ask some question to you. Do you think that coffee is good for you? Is coffee good for cardiometabolic health? Any idea? Yes? Filtered coffee, you say it's good for cardiovascular health. Do you agree? Is coffee good for cardiometabolic diseases? Any suggestions? I have one vote yes. Any others?
Well, on the other side, it does elevate heart rate or pressures.
Oh, that's a good one. Coffee does elevate heart rate, blood pressure. It's because of the caffeine, I think. Eh?
Yes.
Yeah, that's true. Well, that's quite interesting. In the acute response to coffee drinking because of caffeine is indeed that your blood pressure goes up, your heart rate goes up. But that also happens when you climb the stairs, for example. Eh? Physical activity also increases your blood pressure and your heart rate. And that doesn't mean that it's then bad for cardiovascular disease. On the contrary, it can future job and see how we may even disagree on some issues. As scientists don't always agree. You can also debate some things with us. You can just say if you don't agree. So feel free to do so. So I think it's now time for a short break. So let's get back in 10 minutes. Okay, did you have your coffee? So let's ask some question to you. Do you think that coffee is good for you? Is coffee good for cardiometabolic health? Any idea? Yes? Filtered coffee, you say it's good for cardiovascular health. Do you agree? Is coffee good for cardiometabolic diseases? Any suggestions? I have one vote yes. Any others?
Well, on the other side, it does elevate heart rate or pressures.
Oh, that's a good one. Coffee does elevate heart rate, blood pressure. It's because of the caffeine, I think. Eh?
Yes.
Yeah, that's true. Well, that's quite interesting. In the acute response to coffee drinking because of caffeine is indeed that your blood pressure goes up, your heart rate goes up. But that also happens when you climb the stairs, for example. Eh? Physical activity also increases your blood pressure and your heart rate. And that doesn't mean that it's then bad for cardiovascular disease. On the contrary, it can protect even against these diseases. But you were completely right because you are in food technology. I think you studied diterpenes. These diterpenes like cafestol. These are small oily substances in coffee. You can see that when you drink coffee and you put it in the light, you can see some oil on top of the coffee sometimes. And in that oil are diterpenes or cafestol, and they raise your blood cholesterol. So it's good to drink coffee. It protects against cardiovascular disease and diabetes, and maybe also certain cancers or some other diseases, but you should filter then the coffee to take these oily substances out. So there's quite some evidence. I even did some research myself in people who had a heart attack and studied whether coffee drinking was good for them or not, and that was beneficial. But the filtered coffee is then the right thing to do. Okay, so this was just a question to see what you know about nutrition.
How many cups per day?
How many cups per day? That's interesting. It's a bit of a problem to conclude how many cups, because when we study association between coffee drinking and long-term cardiovascular disease, we need cohort studies. But in these cohorts, the number of people who drink over 8 cups a day, for example, is very small. Then you have little statistical power to study the really high intakes. But from the evidence that we see, we can say 4 to 6 cups of coffee shows protective associations with long-term risk of diabetes and cardiovascular disease. But we don't know exactly what happens when you take 8 or 10 cups. I would not recommend that because coffee does raise your blood pressure a little bit, and then maybe that could counteract the beneficial effects of the coffee. Okay, I would like to discuss some types of cardiovascular disease. So as I told you, cardiovascular disease includes both coronary heart disease, which is mainly myocardial infarction and stroke. But I forgot to tell you that also peripheral artery disease, so atherosclerosis in the legs, is also part of cardiovascular disease. There are also other types of cardiovascular diseases, like arrhythmias, congenital heart disease, heart infections, but these are not that affected by diet. So I don't think there's a lot in this course about these type of diseases, except for some arrhythmias, because in the week on pathophysiology of CVD, I think the teacher from human physiology will tell something about atrial fibrillation and certain nutrition-related factors. But these diseases, these three are most influenced by diet. There's also damage to the veins. So the arteries bring the blood into the body, so the oxygen-rich blood into parts of the body, and the veins bring the blood back to the heart without oxygen, and then they are, again, the blood is circulated through the body. So there's also damage to the veins that could also be somehow related to some nutritional factors, but not as strong as the atherosclerotic heart diseases. Okay, so atherosclerosis is a major disease pathway. It starts with building up of fatty streaks and plaques into the inner lining of the blood vessel wall. You can see that process here, and I think you have learned already about atherosclerosis during your studies here, during your bachelor, I think. Is that correct? You heard about atherosclerosis, huh? And such a plaque may calcify and may rupture, and when it ruptures, then there is blood clot formation on top of that plaque, and that blood clot can also travel through the body and block certain arteries elsewhere in the body, or this artery itself can be blocked. And so it's a process that really contributes to all kinds of infarctions in the body. A thrombus is a blood clot that is formed here, for example, and when it gets loose and it starts traveling through the body, we call it an embolus. When it happens in the coronary arteries, or the coronary arteries, I think I should say in proper English, then the blood flow to the heart tissue is blocked. So then the heart tissue, the muscle of the heart, doesn't get oxygen. And then you will get a myocardial infarction. So you can see that process here. Blood clot formation, blockage of the blood flow. You can also have a spasm in one of these coronary arteries that can also cause a myocardial infarction. But the most common reason is the atherosclerosis. And here I have a surgical removal of a plaque, and it's quite nasty to see. It can be quite big. So of course we have much better techniques nowadays, like with different techniques, stents, coronary stents, for example, to get rid of these blocked blood flows. So you will learn more about that. In earlier days, we talked about heart attacks, myocardial infarction, but nowadays it's more common to talk about acute coronary syndrome. And that has to do with more refined diagnosis of the disease. So there's still the myocardial infarction, and there are two types of that, the STEMI and the non-STEMI. In the STEMI infarction, there's a complete blockage of a coronary artery, and in the non-STEMI there is a narrowed artery, but it's not fully blocked. And you can see that on the ECG. When you take ECG from the heart, you can see a difference between the STEMI and the non-STEMI. You can see a different pattern in the ECG. So doctors use that also for diagnosis and prognosis and treatment and so on. And then we have what we call the angina pectoris. That's a kind of pre-clinical or pre-stage of myocardial infarction. So there is less blood flow to the heart tissue, but there is still some blood flow, and it can cause a temporary mini type of infarction and so on. So that's we call AP, and that's a warning sign for getting a real myocardial infarction. And nowadays, often this is diagnosed in an earlier phase, and the actual myocardial infarction is often prevented, because then it's already a diagnosed unstable AP and people get treatment. Yes. So it's called in Dutch dotteren, placing a stent, opening the arteries and make the blood flow again to the heart tissue.